So now our last vitamin, successfully last vitamin from but this is not the last topic of nutrition. The last topic of nutrition will be the protein energy malnutrition. So we will be studying kwashiorkor and marasmus in the next lecture. But today we will be finishing vitamins. Okay, all vitamins. So if you have not taken the classes of previous classes of vitamins, you should check your Google Drive for that and try to listen all the lectures from your first aid book of vitamins, because it is very important topic for your PMDC exams. Okay, so now let's see vitamin K. There are 4 names of vitamin K. Okay, we call it phytomenadione, phyloquinone, phytonadione, and menaquinone. So I remember in the previous exam there was an MCQ in which they used this name phyloquinone. Okay, so people, they are very clever. They know that learning vitamins from the symbols like A, B, C, D, E, so it is easy, but most of the people do not remember the names. So like many of the people don't remember that vitamin B7 is called biotin. Okay, so many of them do not remember vitamin B12 is called cobalamin, or vitamin B9 is basically folic acid. So they try to trick you by writing their names, then the alphabets. So you should remember the names of all the vitamins. Okay, so remember all these 4 names: phytomenadione, phyloquinone, phytonadione, and menaquinone. Okay, so like break them, and you can, when you will revise repeatedly, you will learn it. Okay, now activated by, where's my pen? Activated by epoxide reductase to the reduced form. This is important. Let me see if we have any picture for vitamin K in your Lippincott, because Lippincott is a really good book. Yes, we have this, and any other. So yes, see this picture. So now you have to see this picture. What is going on in this picture is, this is a polypeptide chain. Okay, polypeptide, like peptide is amino acid. Okay, so when so many amino acids combine together, they form a big chain which is called peptide. Okay, so peptide is a polymer, and polypeptide means there are multiple peptides together. Okay, so polypeptide chain, this is a polypeptide chain. And the precursors of clotting factors, as I told you, 2, 7, 9, and 10. So these are the clotting factors 2, 7, 9, 10. Okay, they are precursors. So we always have a when you, if you remember the pathway, let me show you. If you remember the pathway for coagulation pathway. So this is my favorite picture. So if you remember this coagulation pathway, but this is very small picture. Okay, let's see this picture. If you see this picture, you see this 11, this is 11, yeah, this is 11, this is 9. You see this 9 is converting to 9A. So the activated, this little a which is written with 9 is the activated coagulation factor number 9. So the precursor for this 9, activated 9, will be 9. Okay, so now you understand what they're saying. They have shown you the precursors. These are the precursors of clotting factors. Like 2, the activated, there is a 2 and there is an activated 2. There is a 7 and there's an activated 7. There's a 9 and then activated 9. There's a 10 and an activated 10. So these are not activated, these are precursors. Okay, getting my point? So these are precursors. So now this polypeptide chain has these coagulation factors attached to them, okay, and then there is this residue. Just leave the structure, just come to the point. Now what's happening is vitamin K is acting as a cofactor to activate this process, to enhance this process or catalyze this process, okay. But warfarin, the drug, is inhibiting this. So I told you warfarin is an anticoagulant drug. It does not let the blood clot, but vitamin K makes these factors. It converts the precursors into mature clotting factors, okay. So this is 2, 7, 9, 10. So so please people, just remember this. This picture is a really good picture from your Lippincott, okay. So you have to kind of don't remember these structures, but just remember that vitamin K role is to activate, is to make these 2, 7, 9 and 10 mature. And if there's a problem in learning 2, 7, 9, 10, we learn it like this, like 2 plus 7 is equals to 9, and then we have a 10 also. So it's like 2, 7, 9, 10. So you can like remember like this, 2, 7, 9, 10 with vitamin K. Okay, this is your free MCQ marks. This is your MCQ. It can come in your physiology also, like hematophysiology in your physiology portion. It can come in your biochemistry portion. So this is your free marks. Remember, please remember this. Okay, 2, 7, 9, 10 with vitamin K. So let's read a bit of this. So vitamin K is required in the hepatic synthesis. Hepatic synthesis because all this synthesis goes on in your liver. Okay, of prothrombin. So prothrombin is like it is not your, it is your one, okay. So prothrombin and blood clotting factors 2, 7, 9 and 10, these proteins are synthesized as inactive precursor molecules. So it's the same story which is written over here. And this process, you see this carbon dioxide which is adding in for this process, and then there was one C double bond O, the previous one, but this if you open this CO2, it will be COO, right? Because there are two oxygens. So you see this carbon dioxide which enters here is attached in here. So this process is called carboxylation. Okay, this process is called carboxylation, like adding in carbon dioxide. So these proteins are synthesized in inactive precursor molecules, okay, like in this precursor molecules. Formation of the clotting factors requires the vitamin K dependent carboxylation of glutamic acid residues. So remember the word carboxylation, okay. There is how this precursors of 2, 7, 9, 10 is converted to mature form by the carboxylation at this glutamyl residue, this glutamyl residue which is present here, this CH2 and C double bond O. At this level, what happens, there are two hydrogens over here, one hydrogen is here, one hydrogen is gone. So we got this empty electron here. So that empty electron is bonded by this C double bond O negative. Getting my point? This is how we have studied in our chemistry when we were doing FSC. Okay, so please remember these things. These are very important. So let's go back to our first aid book. Okay. So now you see it is written over here that it is activated. So the enzyme is epoxide reductase. Okay. So it is activated by epoxide reductase to the reduced form, which is a cofactor for the gamma carboxylation of glutamic acid residues. There was a very good picture previously, which I once used in my, that picture in my some lecture. Vitamin K I'll find it here, even not that picture, but some picture at least. Hmm. See this picture? This is a good picture. Hmm. This one. So just see this picture. This is that step which I showed you from this book. Okay, this step in this linear form is drawn like this. Okay, so these are the precursor coagulation proteins, and this is the mature ones that were formed, and carbon dioxide was added, and vitamin K was fascinating this process. Okay, so that picture like this is drawn like this here. Okay, now what is going on here? What is it? Another, now here the enzyme was carboxylase epoxidase. Okay, so so this vitamin K, not carbon dioxide, this vitamin K is helping in this enzyme, but the enzyme written in your first aid is epoxide reductase. So what is this epoxide reductase is doing? It is present at this level, the C. Okay, this is it, it is catalyzing this process. So vitamin K is present in many different forms. Okay, so like it is not like a mature form at first, like this is the functional vitamin K. So the thing what this enzyme epoxide reductase is doing, it is converting this another form of vitamin K into this form of vitamin K. Okay, this is what this enzyme is doing. So the food you eat, like this source, the food you eat, you get this form of vitamin K, which is called quinone. You have read the names of vitamin like phyloquinone. Okay, so we got this form of vitamin K from food, from the plant sources. Okay, then this form is converted to this form via this enzyme vitamin K reductase. Okay, and then this vitamin K, the hydroquinone form of vitamin K, is active form, but then this form is again converted to this form of vitamin K for the storage purposes. Okay, the enzyme we don't know, but then this form, which is the vitamin K epoxide form, is then again converted to this form via this enzyme, which is called epoxide reductase. So because basically this epoxide reductase is the is making this vitamin K into a reduced form. You're getting my point? And then it is further reduced to this form, which is the activated form. So now you see in your first aid, they have in your first aid is a very high yield book, right? So they don't write like they don't explain things, they just write it. So this vitamin K is activated by this enzyme, okay, to the reduced form. And the reduced form was, first it was quinone, okay, and then it was hydroquinone. So forget about my writing. It's very difficult to write on a keyboard. So first it was quinone and then it was hydroquinone. So kind of please remember these things, okay? Then uh, it is a cofactor for the gamma carboxylation of glutamic acid residues, as I told you, okay, and on various proteins requiring a blood clotting. So yeah, I have explained you this mechanism now, okay. So synthesized by the intestinal flora. So this is important. Your vitamin K is being made, is synthesized in the intestinal flora, like the bacteria that are naturally present in your intestines, okay. And I don't remember, but I think it is streptococcus. Let me check. Like I also have sometimes a really bad memory, but I think intestinal Flora, your intestinal flora. Hmm. So there are so many. So no, streptococci. So like streptococci is just your small intestine flora. Okay, so now you see there are so many bacterias in your large intestine. So these are your normal flora. These all names written over here of bacterias are your normal flora. Okay, so I just like kind of opened it to tell you that like vitamin K is synthesized by the intestinal flora. So all these names written over here are your natural flora, the natural bacteria present in your um, gut lining. Okay, and they're different. Like in stomach, it is different. In small intestine, it is different. In large intestine, in your colon, there are so many. Okay, so let's go back to our first aid. Then just like K for coagulation, it's like necessary for the maturation. So again, that's the same point is written for clotting factors 2, 7, 9, 10. And then there is a protein C and protein S also. So please remember these all things: 2, 7, 9, 10, protein C and protein S. Remember all of them for vitamin K. Okay. So these are your MCQ points. This is your MCQ point, okay? And then warfarin inhibits vitamin K dependent synthesis of these factors and proteins. Yes, definitely. Warfarin works negative to vitamin K. Vitamin K is helping forming those factors and initiating the coagulation pathway and helping the coagulation pathway to proceed further. But warfarin inhibits that pathway and it does not let your blood coagulate or clot, okay? So they work opposite. Then you have this deficiency. I want to see that there was one more picture in your first aid. So let's see what was that. So now you see they have shown this role of vitamin K in blood coagulation, the precursors, and carbon dioxide is added, so carboxylation to the glutamic residue, and the mature clotting factors are formed. So they have just kind of shown you how this thing happens, and then it goes to the blood. Now from the liver, it is in the blood. Now this is blood, okay, and in the blood this thing happens. So they're telling you that how they are binded to the platelets, because the initial when there is a this is your skin, okay? When there is a cut on your skin and the blood has to bleed, the initial things that come and bind to your membrane are the platelets, right? So that's another mechanism we will study in general patho. So I'm not going into the detail. We have so many steps to that. So we will be studying in pathology. So let's go back to the first aid. So now deficiency. Neonatal hemorrhage with increased prothrombin time, PT, and activated platelet, I don't know, this activated prothrombin time, ABDT, okay? So we call it PT and ABDT, okay? But it is different for all of them. It is very different. So if you have to like kind of remember, there was once in your general pathology, but you have to, this is a like topic of general pathology, but like if you want to know, I can tell you. But here in this vitamin K, you have to remember the only that when you have a deficiency of this vitamin K, you will be seeing the deficiency of factor 2, 7, 9, and 10. And when there will be a deficiency of factor 2, 7, 9, and 10, what will happen? you will see the PT and APTT will be raised. Okay. So I'm finding that, like, I'm kind of finding that picture, but I don't know where it is right now. So I'll search it and I'll click that picture and I'll send in the group. It was a very nice summary that I once wrote in any of my notes, but I am not finding it right now. So let's finish this and I'll send you that picture in from the general patho in the group. Okay. So I should not waste time. Okay, but normal bleeding time. Okay, so you know the bleeding time is different and the PT is different and the APTT is different. If you have this book of general patho or BRS general patho, there was a chart in that book. Okay, I don't have that book right now in my this Google Drive. It is in some other Google Drive, but I will also send you the picture of that chart. If you will learn that chart, you will do all your MCQs right regarding PTA, PTT, and bleeding time. So that was a very good summary of all of the hematologic blood disorders that were causing problems in these PTA, PTT, and bleeding time. Okay, so right now you have to like learn that the bleeding time will be normal, but the PT and APTT will be raised. Okay. The neonates have sterile intestines and are unable to synthesize vitamin K because there are no sterile intestines means no bacteria, no intestinal flora. So when a neonate is born, there is no bacteria inside their gut, in their colon. And because you read that vitamin K is synthesized and is formed by this intestinal flora, so in a neonate, in a child who's just born, right? Neonate is from your birth, from your day 1 to 28 days. Okay, that's a neonate. From day 1 to 28 days is a neonate. So and from and further on, like infant, like the one who's on breastfed. So we are talking about the neonates. Okay, so like even less than 1 month child, they have this sterile intestine, and because there are no intestinal flora present, they can't make vitamin K. Okay, can also occur after prolonged use of broad spectrum antibiotics. So when you use broad spectrum antibiotics that cover lots of bacterias, okay, let's say your augmentin, this is the most favorite antibiotic of doctors who like write it to every patient. So augmentin is your broad spectrum antibiotic. It covers so many organisms. So it also covers those organisms that are present inside your intestine. That is why you have diarrhea when you take these antibiotics. Now you know why you have diarrhea when you take antibiotics? Because they hinder the normal functions of your intestine, which are being done by those normal bacteria present into your gut lining, which are good for you. Not all bacteria are bad for you, some are good for you. So those good ones which are present inside by nature, these antibiotics kill them. So when they are being killed, the intestines become sterile, and when they become sterile, you have diarrhea. So now there are two things when you see vitamin K deficiency. The first thing is you can see vitamin K deficiency in infants, not in infants, sorry, neonates. You can see it in neonates, number one. Okay, why neonates? You should know the reason. Because of their sterile intestines, they cannot make vitamin K. Okay. Number two, in adults who take who take these broad spectrum antibiotics for a longer period of time. When they take it for a longer period of time, the normal flora is destroyed, okay, and that normal flora is responsible for the production of vitamin K. Getting my point? So please remember these things. And what is your blood picture? Raised PT, raised APTT, and normal bleeding time. Okay, please remember these things. Now, vitamin K is not in breast milk. Okay, it is not being passed from mother to infant in a breast milk. Okay, it is not present in breast milk. So now let me tell you one more thing, very important. When a child is born, when you will be starting, when you will do your house job, okay, that's the first clinical exposure you will have. And if you get a chance to work in a pediatric unit, so boys do not work in gynae obs. Normally, they are given some other surgery and allied fields in Pakistan, but they can take also gynae and obs. So, like normally they don't. So, but if you get a chance in studying in working in a pediatric unit, you will see the babies that are instantly born, they call these pediatric doctors, especially house officers, for that work. And you have to give vitamin K injection in the thigh of the baby. Okay, you have to just hold it. It is an IM. Okay, so this is an intramuscular injection. You have to give it IM. So you have to just break the vial and like mm, fill this syringe with vitamin K liquid, and you have to inject it in the thigh muscle. Okay, so you have to hold the thigh, just as you have, if you have ever seen the diabetic patients take insulin on the stomach mostly, because there is a lot of fat, and insulin is like not inserted in the muscle, it is inserted in the subcutaneous fat. So your trunk, your stomach has lots of fat. So even the diabetic patients are obese also, so their belly is fat. So they just hold the fat and inject in it. But so the way they hold the fat, in the similar way you have to hold the thigh muscle of the baby. Okay, very gently, like you not don't break his leg, but like gently hold that thigh muscle and inject vitamin K. So this is very clinical point. Okay, so you should know, and it can be asked in your vivas, it can be asked anywhere, in your house jobs too, and any doctor can like ask you, oh, so you're working in pediatric unit, let's ask you some questions. So you should know this. So vitamin K is given just after birth. Okay, why? To prevent hemorrhagic disease of newborn. You will study this in your hematology pathology. Okay, hemorrhagic disease of newborn. Also, there is a placental cord. Okay, you have to clamp that cord first, and then you have to cut that cord. So you can't cut without clamping. So first you have to clamp it for some time. Okay, and then you have to cut that cord. Okay, so like wait a second, you have to clamp it and then you have to cut it from here, not here. Okay, so when you are giving vitamin K to the baby, that vitamin K is also making these factors inside the baby, because vitamin K is formed by intestinal flora, and the baby has a sterile intestine. It cannot make vitamin K, so you're giving it via injection, and that will also help not to bleed. So the bleeding will be minimized in that baby because of the vitamin K you gave to that baby. Okay, and also there are hematologic diseases of newborn, which we call hemorrhagic disease of newborn. So it will also prevent from that. And also it is not present in breast milk, so that is why we have to give it like the injection. So it's not formed in the body, and it is not present in the breast milk of mother. So these are the things you need to remember for your clinical purposes, for your exams. Okay, so first aid is a very good book. If you read line by line and understand what's written in it, You don't need to go to any other books. Trust me. This is a complete book for everything. But you should have good concepts before studying this book. So now today we studied vitamin E and vitamin K in pretty much detail, and I think all of your queries are clear. I told you the important points for MCQs as well. So this is all about our today's biochemistry class. Thank you so much. And we took a 1 hour 30 minutes class today for biochem. And the tomorrow we will study zinc and kwashiorkor and marasmus in biochemistry. And then the next topic will be, inshallah ta'ala, the metabolisms. Okay, we will start with the metabolisms because that's the most crucial and difficult part. So we will start from that, from your book, first aid book. And I don't know, I'm not sure about if I will have a class tomorrow or not. It totally based on my schedule, but if we will not have a class tomorrow, we will have the class on Sunday. So there is a class on Saturday already, and if I will take the class tomorrow, no class on Sunday. But if I will not take the class tomorrow, the class will be on Sunday. Okay, so there are some things that I have to sort out, like uh, from the hospital schedule. So okay people, thank you so much for your time. The next lecture will be of pharmacology, okay, or maybe physiology, let's see. And the time will be, it's 5:18 right now, so let's make it 5:40. Okay, so the class will start at 5:40. Okay, thank you so much. If you have any question, you can ask me, and if you don't have it, no problem. Okay, no questions. Okay people, thank you so much for your time today.